Okay, so yeah, let me just tell you a little bit about the history and then you can take this anywhere you want. This is your time. I want to answer your questions.
Sounds good.
Um, so what's unique about my situation is I wasn't a physical therapist. I was a personal trainer. I was a strength coach. I had a background in business. Like I just have always been an entrepreneurial spirit. I love business. I love turning ideas into money. I don't even care about the money. I just love the ability to turn an idea into money. So
Yeah.
I was that kid in the neighborhood who would, buy fireworks in bulk and sell them to other kids on the block. I went to high school down in Sarasota, Florida. I graduated high school in 1993. That gives you any perspective. I'm 49 now. But even after high school, I was like, oh, I can't sit in a college. I can't sit in another classroom. So I ran a plant store and landscaping business. My family owned some commercial real estate. The person who had a plant store was going out of business. So I was like, I'm going to take it over and I'm going to run it. I was obsessed with martial arts at the time as well. So I used to travel and teach martial arts seminars with my instructors, Muay Thai, Kali, and a little jujitsu. And so I had no idea what I wanted to do, but I always knew I wanted to do business. And what got me into college was multiple years of martial arts. I was like, I need a degree. Everybody I respect in the martial arts community was college educated. And so I was like, I'm going to go get my bachelor's degree. Graduated high school in 93, went for my bachelor's in 97, got a bachelor's in kinesiology, graduated in 2000. And then I started a personal training studio. And that's when I got introduced to physical therapy. And a year in, I was like, I need to turn this personal training studio into a physical therapy clinic. I found an amazing therapist that I was working with. She was the kind of therapist that would just light up the room whenever she came in. All of her patients loved her. The problem was she was a traveler and she was getting ready to go overseas. So I begged her to come with me. I wasn't a physical therapist, so I couldn't start a physical therapy clinic, but I was like, just work out of my personal training studio, help me get the ball rolling, and then I'll replace you when you go to your next travel assignment. Well, she's now my wife. We have four beautiful boys. Similar to you, my oldest is 15, my youngest is 12. So we're kind of in the same phase, just a little bit older than yours.
No. No.
And, I've always been passionate about physical therapy, but I've always wanted to protect that passion by not tying my finances to it. Yes, I own a physical therapy business. And for context, we went from our largest, we were at 5 clinic sites. We had 3 in Florida, we had 2 in Ohio. We had a team of clinicians. We had our billing, our marketing, our admin. We started consolidating sometime around 2009, 2010, I think. And now we're down to just 2 physical locations here in Ohio. I do still treat patients a couple times a week, but I protect my passion to do physical therapy by not tying my mortgage payment, my car payment, and my finances to physical therapy. I run the business to take care of my financial security. And so I've always just been totally fascinated by how we can leverage what we love to do, what we already do, into multiple monetization strategies. And I think that's probably what most people think about when they hear my name and they talk to me. So any questions you have about anything, I'm an open book. I'm happy to share.
Thank you for that backstory. I've wanted to learn about that and the evolution of Tony, and
Yeah,
thanks. It's super cool to hear. And what a blessing to meet your wife along the way.
I
And
know. So lucky.
I think one of the questions that comes to mind is, okay, there's a lot of therapists out there. I think you and I both do this social listening where we are in various groups and we hear a lot of both positive and negative. And I think on the negative side, a lot of people are burned out. They see a lot of, on the traditional side of therapy, a lot of reduced reimbursement, a lot of kind of decline in how the government might see the demand for therapy. And then on the other side, you have, all these kind of innovative models, people making courses, doing things. So for the person who's, I call it the bridge area where they're like, I want to be there, Tony. I want to be in in that land of where I don't have to do therapy as something that pays my mortgage? Do they start with something more digital? Do they start with a traditional practice, more of like a service-based business? Because you have these talking heads, even outside of therapy, who will be preaching both kind of concepts, like start a service business, it's the best way. And then other people, no, start a digital product. There's low overhead, little logistical stress. Do that instead. And pros and cons. I don't know if there's a clear path for either one, honestly, depending on the progression of the person. But for that type of therapist who's depending on a job right now for their mortgage payment and for those things, but they have similar feelings like, oh, that would be really cool to, kind of protect my passion, as you've put it. What are your thoughts on what steps they should consider in their decision-making process?
Yeah, I mean, I think it's important we acknowledge like a lot of working therapists today just feel like they're in quicksand. It's like the harder they struggle, the more they do, the deeper they sink and the faster they sink.
Sure.
It's one of those things. I always say if you are a patient going to physical therapy, you could see 10 different physical therapists and get 12 different solutions to your problem, right? And this is no different. We all have our opinions, we all have our biases. I'm in that pool as well. Even my opinions have changed, my advice has changed. If people listen to my content 10 years ago compared to now, I say different things. But the reality is, I think first we need to stop the bleeding. So many therapists are so busy documenting, treating, trying to keep their head above water. They can't imagine putting one more responsibility on top of
Sure.
that list. And when I talk to therapists, they're like, "Oh, I want to do YouTube, I want to do video, I want to create digital courses." They're like, but I just don't have the time. Because every minute you take away from family, from work, from something else is a minute you're losing. And so the first thing I do is I try to convey the reality that yes, I understand where we're starting. We have to know where we're starting. Then I love the Gary V quote, Gary Vaynerchuk. Don't think of creating, think of documenting. And when you look at my YouTube channel, if you look at the top 5 performing short videos on my total knee replacement channel, they're all video clips that were just recorded on an iPhone. Nothing special. It's not even a new one. This is a 12, I think, in the clinic. And what I would do is I'd grab my phone, I'd focus it on the patient's knee because these happen to be knee replacement videos. And I would just explain to the patient, first day of therapy, what was going on with either their incision, their wound, their dressing, what they could expect. It's a 15-second to 30-second video clip, no editing, no special lighting, no post-production, anything. And those videos right now have over 250,000 views each. They're continuing to grow my audience. But it took no work other than pulling the phone out, hitting record, of course, having a HIPAA compliant release form, which really should be done at admission. At this day and age, 2024, if we're not getting HIPAA consent for media releases and getting that content out there, we're living in the 80s. Like that is just something that everybody has to include. But that being said, like all I had to do was hit upload. Give it a title. That's it. No description, no thumbnail, nothing else. That is where we start. And as we start to do that, what you start to realize is if I treat a patient, and this is an example I share a lot, if I treat a patient, new evaluation, just got referred for a total knee replacement, I might get $150 for that evaluation. If I'm an employed therapist working somewhere, I might earn $50 for that hour of my life. But I'm never going to monetize that hour again. Once that hour is spent, it is gone forever. But if I simply document, not even the entire hour, just a couple elements, somebody says, well, should I put heat or ice on my knee? I pull out my phone, I point it at me, and I hit record when I answer that question. Um, those little pieces of content, the person who needs to know if they should use ice or heat is the same all around the world. Right now in this country, 800,000 knee replacements a year are being performed. That's 800,000 people that need to know the answer to that question. They're never going to be my patient. One of them, three of them might be, but for the rest of them, I'm going to let YouTube monetize the answer I provide them, because YouTube will run an ad on that video. The video is free to the consumer watching it. YouTube will monetize that video with an ad. YouTube will give me 55% of that ad revenue that I could never otherwise collect on. And so now what would have been an hour of my life sold for $50 or $150 or even $300 could turn into thousands of dollars, because that is a piece of evergreen content. And when you look at a typical therapist's day, they are creating immense value, more value than a third-party payer could ever pay, more value than an employer could ever pay. Therapists are amazing at creating value. What they're not good at is understanding how to capture that value, how to monetize that value, put it in a digital course, put it on YouTube, put it on different platforms, turn it into an audio soundbite that somebody could listen to while driving in their car. That is where literally any therapist, PT, OT, SLP, right now today with totally free tools could be generating $1,000 an hour worth of value and monetize that for hardly any extra work. And I think most of us would agree that if we were making, and I share this publicly, I was making $130,000 a year as of 2023 between 3 or 4 platforms. It was YouTube, it was a little digital course content, and affiliate income. $130,000 a year without adding any extra work to my plate. If we had that kind of income, we could probably see fewer patients. We could do a better job with the patients we see. We could spend more time with family. We don't get burnt out. We don't deal with a lot of the challenges that therapists are dealing with right now. But like you said, we have to build that bridge. And I think that bridge starts with, okay, I'm going to capture these little bits and pieces of value that I deliver every single day already.
Yeah, I love it. And so for the person, kind of going back to that person who's like, man, really, kind of what you said at first with their psychology is, really, I have to figure out the course tools and how do I record and how do I edit, and it's going to be a full-time job, Tony. It's not so easy as just pulling out, it is and it isn't, right? Because the practice will take time, and all, like I'm doing now, I don't have as much practice as I need. The ahs and the ums and these types of things that you get better at. So this person, so you'd suggest, let's at least start just pulling out your phone, recording content, gathering it. Okay, what are they doing as a next step? Are they just focusing on building an audience, or are they putting that effort into more of a course? I understand you have, I think it's 0 to paid. Is that right?
Right. 0 to paid is a Medicare billing course because I saw a problem. Therapists didn't understand how to go from being a W-2 paid employee to starting to see patients on the side, whether it be mobile or brick and mortar or anything like that. And I thought, and this is going to relate to what you're asking. I thought, I've got this knowledge, I've got this experience. I made 1,000 mistakes. I've shared publicly when we first started our physical therapy practice, we didn't know how to hire a biller. We didn't know how to do billing. I didn't know how to do marketing. I didn't know how to do hiring and firing. I didn't know any of it. We lost $60,000 on the first biller we hired because they didn't know how to bill for physical therapy services. And we lost another $30,000 on the next biller. So the idea is, I've got this experience in my head. All I need to do is package it so I can deliver it to other people who could benefit from it. There isn't a single human that's going to listen to this interview, this podcast, that doesn't have some sort of unique value. Even something as simple as your ability to document a certain movement. I remember, and still to this day, I remember I'm like, how do I document? How do I say in words that the patient is unable to sit to stand without use of their upper extremity to push up from the seat? Like, what's the most succinct, concise way for me to say this patient needs to use their hands to push themselves up when they're getting out of a chair? If you have the answer to that, if you've been documenting that, you can package that in a little snippet of documentation. You can put that into a Google Doc and you can sell that because you took the mental energy and the time and the effort to develop that. That is a tool with value. And then whether it be a student or a new grad or even a seasoned professional, if they could save 30 seconds because they don't have to think about how to say those words because you've already put the words together, that has huge value. So back to your original question, where do people start? I think you just got to start doing the reps. We're all
Hmm.
therapists. Our advantage here is we see patients struggle to learn how to walk again after they've had an injury or a disease. We see patients go back to zero to start regaining their abilities. We're in the same boat. If I'm not comfortable talking to that little black circle, I just need to
Hmm.
start doing it. I need to
Sure.
do the reps, get comfortable with it, know that it's going to be ugly, know that it's going to look bad. Um, and I can tell you, if you look at my public channels, you'll see thousands of videos that are public. What you don't see is the 20, 30, 40,000 that never made it onto the platform.
Sure.
So if I was a therapist today, sitting here thinking, how do I do this? My employer won't let me record video in the clinic. No problem. You go sit in your car after your shift. You take
Sure.
5 minutes. You turn on your phone. You point it at yourself and you answer the questions that you were asked that day. Do I do, is it better for me to lift weights or to do cardio to lose weight? Should I sleep in my recliner or in a bed after rotator cuff repair? Just answer those questions. Even if you never share that video, the fact that you're recording it and building repetitions is going to make it so that when you do start to share that on public social media platforms or in a digital course or in a blog post that you write that's going to get monetized with affiliate links and traffic, you will be better in the future. That's the whole idea. Those baby steps every single day.
I think that, at least as an occupational therapist, that really resonates. I often think when I'm seeing kids, I work again in school-based occupational therapy. So a lot of the time, the frame of reference I'm using is largely developmental. Where are they supposed to be? They're in this grade. What are the grade level expectations? What are the developmental expectations? And then what am I seeing in terms of performance or perhaps participation even. And then I think sometimes we forget about that as therapists. When we haven't done the reps, you know,
I'll tell you
we're
right now. So I came home, I think it was last night, might have been the night before. So I have twins. They're in seventh grade right now, and they've been playing on a baseball team with, their friends, and we've avoided going to a select baseball team because we don't want the commitment. It's not their primary sport, and they just want to have fun. They just want to play at a rec level. They want to have a good time. They want to be outside. So anyway, I'm at our first practice for the spring season and we have a couple new kids that are joining the team. And so, like I said, these are kids that are kind of they haven't moved on to select teams. Some of them maybe never have even played. And I don't do anything with pediatrics, but I do. My wife does a ton of coaching. She coaches basketball, volleyball, multiple sports. I'm really involved with the school and elementary age kids. And I heard a dad for the first time in at least 20 years. I might not have ever heard a dad say this. Dad came up to my head coach. I'm an assistant coach. He's like, "Hey, I just wanted to let you know my son is on the autism spectrum. We're just here to have a good time. We're not expecting a whole lot. He just loves baseball and wants to be out there." When I think of you, and I think of you being in that world of, education and OT and all of this, and I think of what I see as an opportunity, what I see as a need is We, every single season, every single year, have at least one child that is clearly has needs that are not being met. I don't even know the right language to use, so I don't want to offend anyone. But basically, like, these kids are not developing in a typical manner. These kids have, unique experiences that need to be accommodated for. And the parents don't know. The parents genuinely have no idea. We just had a child the other day that we assumed they were on an AEP. We assumed they were getting services. Apparently they weren't. Mom comes up to my wife and she says, "I'm devastated. I don't know what to do. My son is being assessed by a local children's hospital because they think he might have autism." And we were just so shocked that it's never even been addressed. Like, how are teachers not talking about this? How are other coaches not talking about this? And so taking somebody who has experience in that world and providing resources that just answer questions for parents, for coaches, for teachers or teachers' aides or any of those populations to say, hey, you might look at these certain signs, you might look at these certain characteristics, like these might be indicative of somebody who might need additional assessment or services, because the general population is still completely blind to what these children need. Like for you, that I think is an instant no-brainer. Put something like that out there. Even if it's never monetized, it will deliver huge value to all the parent volunteer coaches that maybe don't have a clinical background, but they're like, why is this kid afraid of the ball? Why is this kid talking to himself? Why is this kid not focused? And rather than penalizing the kid, helping the kid get the services they need.
Exactly. That's a challenge every day with all sorts of conditions and circumstances and stages of development. And I think, as you were saying that, I was like, a therapist out there, they really could, if they saw that, they saw that at the pickup game. I just got done finishing coaching my son's second grade team as well. And, when you're out of the gym or when you're home, you could pop on the cell phone video.
Yep.
Throw something out there. And I think sometimes we forget that maybe there's a lot of value in helping the kids get the services out in this digital manner. If we had 100 more therapists doing that, how many more hundreds of parents or even thousands would be getting their kid on the right path to the type of services they need faster? Maybe they'll get them eventually, but doing it in a timely manner has benefits. So I really love that.
I think a great example would be, look at Nurse Nancy on TikTok and YouTube. We had a family member that was going on hospice. We never really had any experience with hospice. We were looking for resources. Obviously, there's Facebook groups that we joined. But when we found Nurse Nancy's like short video clips, it answered so many of the questions, and it gave us such a better idea of how to help somebody who's going on to hospice, who has some cognitive decline, who has episodes of confusion during the day. And her channel is over 1 million subscribers, I think, at this point. And all she does is she turns on the camera just on herself and answers questions that she addresses in clinical care every single day. As much as you think it's probably already out there, I guarantee you there's not enough of it out there. There's always an opportunity for more.
What I was thinking in my head, and again, I have that active mind where I should be working on 100% focus on active listening. But nonetheless, the question that was inspired from what you were saying is, the person, I think the therapist, one thing they're thinking is, there's 1 billion YouTube channels out there. There's 1 million podcasts. I am going to get just totally destroyed by people who know what they're doing. They're more technical. They're better with marketing than I am. Why do all of these reps, if I'm not even going to be able to compete? It's like, right, for an athlete, why should I show up at the weight room, do the sprints and agility training and all of that, do the practices, if if I'm going to be on the bench the whole time.
You
And,
know what's interesting about that, and you're right, it's 100% you're right. What's interesting about that analogy, and I think about this all the time, is like we're here in Cincinnati, Ohio. So the Reds are, getting started, baseball's happening, and I think of all of the professional league baseball players, none of which I know their names, but I knew Joey Votto, right? He had a $40 million contract. He just left the Reds. He signed with somebody else. So I think of all of the people that are at the professional level that I have no idea who they are, yet they continue to play. And then I think of all of the people at the double A, triple A level. And then I think of all of the people at the college level, and then the little league level, and then the Pee Wee level. And I'm like, none of these people are ever going to monetize their ability to play baseball, but they still play baseball because it's important to them. They find value in it and they enjoy it. And I would say the same thing to your point. Yeah, you're probably never going to get any views, and you're probably not going to be Bob and Brad or Ask Dr. Joe and get to millions of subscribers. But I guarantee if you record your answer to that question and you put it on the platform, at least you're doing your part to share that information, because it could hit somebody on the other side of the world that doesn't have access to healthcare information and things that we have, and you might change that person's life forever. And ultimately, I mean, that's why we're here. That's what we're doing. We're doing this because we want to help people. None of us said, I want to earn $30 million a year, so I'm going to become an occupational therapist or a physical therapist or anything. We're like, hey, I want to help people. I want to deliver genuine value. And I promise your perspective is always going to be different. Even if there are 100 other therapists trying to say the same thing, your perspective is going to be unique to you.
Amen. I love that. And I would just also add, whoever's listening, I'm far less experienced than you in this game, Tony, and I appreciate getting reps here with you.
Yeah,
But I think the fact that there are people doing something similar, it means there might be some demand for it. So
absolutely.
I always think, hey, there's a demand for this, and I can capture some of that demand. It might not be all of it, but I'm gonna join the game as well. Um, so that being said, I want to just rewind just for one quick question
Yeah.
on, before we run out of our time limit here. For the therapists who do have a business, a clinic or an organization, you can put yourself in that position of, hey, if you were starting your practice brand new 2024, you have to do a therapy business, let's say, rather than just going full on digital mode. Because like you said, there are benefits of, if you have your own business, you can do a little bit more with content creation, maybe get a little bit more creative that way, work with patients in unique ways, perhaps like ones you've suggested, doing a free session in exchange for them allowing you to, have that online in various places and ways. So I don't know what the happy medium is of respecting their privacy and confidentiality with also being like, hey, let's get you a free service. But that's an example. So a therapist who's got to start a therapy business, on my mind, one reason I haven't done it is like, I don't want to put in all that work for the dismal return. And I do want to help people, but I also want to spend time with my family.
Yeah.
And so it's like, is there a way that I can do something more? Maybe I've heard you suggest like package a full solution that may not be totally covered by insurance and then sell that solution. And if all they want is the insurance covered part, then maybe refer them to somebody else. Is that kind of still something you'd recommend to people, or have your thoughts changed on that scenario?
No, absolutely. That's exactly kind of embodies what we're trying to do. So as a practice owner in 2024, what I do is I try to look at what are the available resources I have. When I started in 2001, I didn't have social media. I didn't have YouTube. I was hanging business cards at the sandwich shop and I was bringing lunches to the doctor's offices. We're in a completely different time today. There are so many more ways to make this work. So if I was wanting to run a private practice, I was wanting to really work at the highest level of my capacity, yeah, I would create a program that includes everything. Like for me, I can't imagine talking to somebody about rehabilitating a total knee replacement, a rotator cuff repair, any orthopedic condition without including some discussion about nutrition, without including some discussion about sleep, about mindfulness and meditation, about exercise for just general health and performance. Well, none of those things are covered by insurance. And so if I was starting a new practice today, what I would be looking at is I would say, I want to solve this problem. This is typically the solution. It's a comprehensive, it's a holistic solution. I understand that maybe in the beginning, I'm going to focus on the lowest hanging fruit, right? Medicare is going to pay on average about $100 reimbursement for a 60-minute session. But I can't really deliver what I want to deliver. I can't go buy a Mercedes or a Ferrari for the price of a Honda Civic. Like there is always going to be these limitations if I don't have the resources to deliver the experience. So I would develop a business model that says, this is what I do. I only see patients who are able to commit to a $5,000 plan of care because $5,000 is going to give me enough money and enough resources to deliver the mindfulness, the meditation, the sleep education, sleep hygiene, all of those things that are required to really make a change in this human's life. If I want to kind of broaden my audience, I say, okay, I'm going to contract with Medicare because we know that there's mandatory claim submission laws. And if somebody comes to me as a Medicare beneficiary, I am going to make my recommendation on the plan of care. But if that patient says, no, I only want what Medicare will pay, I very nicely, politely say, that's totally fine. It's well within your prerogative. Unfortunately, that's not what we do here. So I want you to know that this is what's available and this is what I recommend. And this is what I think is going to be necessary for you to meet your goals. But if that's not something you want, there is an amazing therapist, like for me, it's across the street. They work at NovaCare. They only deliver what Medicare will pay. You'll have a wonderful experience. They're a very kind, warm-hearted person. And then if in the future you decide you want to make this change, come back. And I think we as therapists need to divorce ourselves from the mindset that we should try and sneak and hide and put everything into CPT codes because that's not really what's intended. And one of my favorite stories, I have a large Facebook group for patients who have had a total knee replacement. We have about 13,000 members. And one of my favorite questions to post in that group is, when you started physical therapy, what was your goal? In your own words, what was your goal for physical therapy? And you know what nobody ever says? Nobody says, I want to dress myself. I want to bathe myself. I want to groom myself, which are Medicare covered goals. Everybody says, I want to travel. I want to hike. I want to bike. I want to do recreational things. I want to play with my grandkids. Right now, you as an occupational therapist, you understand the value of those goals. And I do too. But those are not Medicare covered goals. Medicare clearly says they don't cover goals focused on recreational activities, on sports performance, on general health and wellness. So what we've always done as clinicians is a patient says, I want to golf. And we say the patient needs to ambulate 25 feet. Well, the patient didn't give me that goal. We have been conditioned to turn, I want to play golf, or I want to hike, or I want to go to the Grand Canyon into the patient needs to ambulate 25 feet because that's what Medicare is going to pay me for. And I think in that we do a disservice to ourselves because patients are happy to pay for the things that they want. They're not happy to pay for the things they don't care about. They don't care about walking 25 feet in many cases because they're going to do that anyway. So if somebody, a therapist, wants to make 250, 300, I would even say a therapist in today's economy could probably sneak out 400,000 a year in a single owner operator business if they structure it properly. No employees, no staff, no headaches. I think you could do that, but you can't do that only treating Medicare beneficiaries for Medicare reimbursement. And again, I go back to when you look at the way the system's set up, you and I, you're an OT, I'm a PT. We get the same patient referral. Let's pretend you're an outpatient orthopedic because that's my world. Patient comes in, they have Parkinson's, they've been falling 2 or 3 times a week, but they haven't broken anything yet. They have back pain, hip pain, knee pain, right? You're an amazing OT. You develop a 36 visit plan of care. I'm an average, good enough PT. I develop a 6 visit plan of care. I teach my patient what they need to do to improve their ability to transfer, to stand, and to walk. You go through all of these incredible, creative, exciting, fun exercises. The patient's engaged. The patient loves it. They want to come to see you. They don't even care if they see me. At the end of the day, you do an amazing job. Your patients love you. Your patients get better. Your patients thrive after therapy with you. I do a good enough job. My patients get the information they need, but they don't apply that information. They don't use that information. If anything, they discharge from me and they're no better than they were when they started. The way the current system is set up is I have a lower risk of audit because I did fewer sessions. You have a higher risk of audit because you did more. There's a chance that you might even extend beyond 36 visit. You do 105 visits. You have to refund money if the Medicare reviewer determines that you did more than is the standard of care. I don't have to do anything, but my patient didn't improve at all. So the system is so bloated. The system is so big. It does not reward great therapists. If anything, it rewards average to below average therapists. And so if therapists really want to do what they went to school to learn how to do, they need to utilize all of the resources available to them. They need to utilize insurance reimbursement because that gets a lot of patients through the door. It gives you the opportunity to expose what is possible to new people. But then they also need to be able to offer hybrid models. If you want to be going back to golf, even though you have Parkinson's, let's do a golf performance program that is not covered by insurance, but is a self-pay option. If that's too expensive, no problem. I've got a recorded video that covers all of the stuff that you need to get back to transferring independently from sit to stand. It's $25. It's $5. It's free. I don't even care because it's not taking any resources away from me as a therapist once I've created it. So I think the thing we need to do as clinicians is just ask better questions. What is it that I ultimately want to deliver? What is the outcome I'm seeking to achieve? What do I need for myself, for my family, for the things that are important to me? Because the happier I am, the better I'm doing, the better a clinician I'm going to be. And so we ask ourselves those questions. We develop new answers, new solutions to those questions with the technology we have available. I think everything changes. We eliminate burnout. We eliminate frustration. I don't even care if Medicare reduces my reimbursement another $10. Doesn't matter because it's such a small percentage of where I'm actually making my money.
That's such a huge lesson, I think, for a therapist because number one, they're trying to play with a budget that's unwinnable in my mind.
Right.
You got the rehab managers or whatever, and people have said to me, "Oh, like you've got a business mind, you'd be a good rehab manager." I'm like, I don't want to play with an impossible budget.
Yeah.
If I'm the one who creates the system where that budget can thrive, cool. And I think that you've led on to that fact. So I think a few lessons, correct me if you have anything you'd like to change on these points, but I think a few lessons for kind of people in that, going back to that bridge area that I described, like they're still working, they want to kind of get out so they get more time, more opportunity to create more opportunity to serve people at a higher level. What's going to need to happen is they're going to need to really think about, if I haven't started the therapy business, I need to really think about the full solution and not just the things that are pertaining to insurance, number one. And then number two, when I've done that, maybe just do a quick look at what are my expenses and what are my profits? Is this going to allow me to invest significantly into the growth, into the operations, into the team and whatever, so that I can do what you're suggesting I do. So I think first, for therapists out there, this is a great opportunity to do a business that is not only a therapy business, but one that could be a profitable, thriving business. So I think you've answered that big question for a lot of people is, can a therapist even really do a profitable, thriving business? It's very doomsday. It's impossible. Insurance, blah, blah, blah. Everything is against us. Let's get out of that negative thinking mindset and move to, let's get creative. Let's be problem solvers. Let's start to learn how to communicate better. Because I think one of the X factors in that whole story is your ability to communicate. And you've communicated eloquently in your example situations, with the people and the patients proverbially that had Parkinson's and how we'd handle that. But the X factor there is some person might be a therapist who's like, all right, let's get you going. Whereas somebody else might take 15, 20, 30 minutes to talk to that person and their family and being like, hey, let me just do a quick education session with you. And that is something that doesn't even have to be in person. I don't believe it could be,
Right.
but you might have like, a 30, 45-minute video that you say, hey, before anyone becomes our client, we actually require you to watch this video. It's too important for us. Sorry, I got some windows popping up. It's too important for us to start down this journey without you having a baseline knowledge of how things are going to go, because you're going to be directing what you want us to do, and without this knowledge you can't do it. And I've learned that from some programs I've done in business outside of therapy, but just kind of priming them. And again, I see that as a huge X factor. What you said, hey, we could probably provide this service, but honestly, I don't really think we're going to make a huge change in your life. Maybe we'll get you to the toilet, and that to some people that's a huge change, and no shade to that person, but what we're really trained to do here at our business is X, Y, and Z. So really having a strong, we call that positioning, having a strong positioning, I think will be huge for therapists. So I want therapists to go away with the belief that I can start a therapy business today, even in 2024, and it can be successful, even potentially lucrative. And I know, as you said, we don't necessarily go into the fact of, I'm in this profession for making all the money, but I've also heard people say more good people should make money because they'll do better things for the world with those resources. And I think, I don't know if you agree with that, but I hope more people agree with that. I think there's more need for good people with a higher amount of resources.
I agree. The one we can wrap up with this. The one thing I always try to say is if I want to help more people who can't afford my services, the best way to do that is to start by helping more people who can afford my services. If I have an abundance of revenue and profitability, there's more time available for me to help the people who can't afford. And that's something that gets lost in translation here, is that I can do so many more things for people who pay me zero money because I do those things for the people who pay me a ridiculous amount of money.
Mm-hmm. Well, I think that we need to do this again sometime. I've enjoyed
Absolutely.
chatting. I've enjoyed getting my rep, but
Good.
walk away with believing that it is possible with a little creativity, and then pull out that phone and start recording, get your reps in, and next steps will follow if the
Perfect.
person is curious and motivated. So appreciate it, Tony. Good luck on the rest of your day, whatever you've got lined up.
I will. Thank you, Andy.